Good afternoon and a very warm welcome to the National Virtual Health Tech Conclave. I do hope all of you are keeping safe. And as we begin this exciting panel discussion on future hospitals, health quality and patient experience. In this session, we are joined by a set of experts who will be bringing different perspective on this issue. All of us know that this pandemic has thrown up a whole lot of challenges in the health system and has the hospitals take the spotlight in kind of addressing the issue. We're also trying to understand what needs to be done for the future, for the new normal. We're also seeing how social media and different groups with their different information sources are coming together. And to a very large extent, the fact that India and its digital health has taken a step forward will play a key role in figuring how the future is going to be. And so it is quite heartening to note that today in this panel, the experts that have in this come from a range of background, experience, and expertise. So let me introduce very briefly each of our panelists, and then I would hand it over to them to take a minute or two to introduce yourself, your work, your organization, and what the current reality means to your organization as we move forward. So we have in this session, we have Mr. Sumit Puri. He's a group CTO, Evercare Group. We also have Mr. Gunjan Kumar, healthcare technologist. We will also be joined by Mr. Shuvankar Pramanick, CIO, Columbia Asia Hospitals. We will also have on the panel Mr. Abdullah Saleem, Group CIO, Omni Hospitals. We also have Mr. Naresh, Duble, Head Continuous Improvement and Marketing, Knauf Sealing Solutions. And we're also joined by a person with a large amount of experience, Mr. Ajay Bapat of Packaging Concepts. So could I invite Mr. Sumit, would you kind of introduce yourself and then take a minute or two, and then I would ask the rest of the other speakers to follow suit. Over to you.
Thanks, Preethi. So I'm Sumit, and I'm basically the Group CTO for Evercare Hospitals. We have about 30 hospitals in various countries, India, Bangladesh, Pakistan, Nigeria, Kenya, with headquarters in Dubai. And before this, I was with Max Hospitals. I've also spent time with PricewaterhouseCoopers, GE, etc. That's about it from my side. I'm looking forward to the session. Thank you.
Mr. Gunjan?
Yeah, am I audible?
Yes.
Okay. Hi, my name is Gunjan Kumar. I'm a healthcare technologist. I started my career as a marine engineer. I'm a gold medalist from DMET. Then I moved to healthcare. And since last 17, 18 years, I've been into healthcare. I have headed a couple of hospitals, and now I'm working as an independent healthcare technologist. I'm working as a bridge between two institutions, that is healthcare and financial institutions, the venture capitalists, and trying to help the healthcare fraternity and healthcare systems from outside now. Thank you.
Mr. Abdullah Saleem, could I ask you to introduce yourself and your organization briefly?
Thank you very much. My name is Abdullah Saleem, and I am working as a group CIO for the Omni group of hospital, which has got almost 7 hospitals in down south of the part of the country. And I look after the complete digital transformation for the group. Prior to that, I was working for OHM Healthcare Solutions Private Limited, which was the first EMR company in India. And I know Sumit a bit better that we have worked together when I was working in home health solutions to supporting and delivering the EMR deployment. Thanks.
Okay, thank you. Mr. Ajay?
Yeah. Hi, my name is Ajay Bapat, and then from the introduction of others, I think I'm from some different background. Like I've always been working as a packaging technologist, and all along in pharma packaging business. So maybe not directly related to hospital or healthcare, but then as a supporting function, I think I will be able to contribute to today's discussion. Thank you so much.
I think, yeah, you are on mute. You are on mute.
Hello.
Ajay, we could not hear you because I thought you were on the mute.
Well, is it now? Am I audible now?
Yeah, he was audible. Yes.
Yeah, he was audible. Yeah.
Oh, okay.
But,
You
yeah,
can
maybe
go
you can
again.
do one more round of very brief,
Yeah.
Mr. Ajay. You can just do it once more.
So should I?
Yes, please.
Okay. My name is Ajay Bapat, and from the background that was being discussed by other fellow panelists, my background is a little different. I have always been working as a packaging technologist, and for almost last 3 decades, I've been in pharma packaging business, supporting healthcare from packaging side. So maybe in today's discussion, I will be contributing from that point of view. Thank you so much.
All right. Thank you so much. Mr. Naresh?
Yeah. Hi. So I am an engineer by education. Worked with Siemens to start with. Then I was with IBM as a product manager. For last 18 years, working with Armstrong Selling Solution, which is now Knauf Selling Solutions. And last 8 years, I'm in charge for education and healthcare verticals in India, and also take care of Asia responsibility for upgrading our staff, our partners. We call it commercial excellence, working around SFDC and technological adoption. So that's about my work. But I'm critically passionate about sound and acoustics and way it impact our buildings in particular. And we'll speak about that in the next sessions. Yeah. Thank you.
All right. So moving on into the session, I think we know the world as we knew, the normal as we knew, it's completely changed. And as we are, I would say, in a transition period before we actually move into the new normal, which at this point, we're not sure when that's going to be, but whenever this pandemic gets over. But in the meanwhile, what we are seeing is that there are major changes. And these changes are rewriting or probably redesigning different things from a hospital perspective. And we are seeing technology, information playing a key role in making this happen. Social distancing is a norm. How do we provide clinical care with this kind of options that are there now, or the newer protocols that are there? And as hospital leaders who have really seen all of this from the very front lines, taken a lot of decisions on how to move things forward, use data for better decision making, providing live evidence through the informatics that you have. So, what are leaders like you in different industries? How are you visualizing what needs to change in order to better health quality and patient experience? If you could share your thoughts, your experience over the last 1 year or so, I think it would help the audience to understand what's really happening and what needs to happen. Mr. Abdullah, could I ask you to respond, please?
Thank you very much for asking the questions. As per my experience recently in terms of the patient experience, and not only the patient experience, of course, the provider experience with the treating doctor who are treating their patient, The technology has played a major role in terms of patient satisfactions and the provider experience. Recently, that we are talking about the pandemic, and most of the hospitals which were not understanding that technology is going to play a vital role in terms of their top line and bottom line, and on top of it, the best experiences in improving the experience of patient and the provider. So recently, in the first phase of the pandemic, where we introduced hotel quarantine, home quarantine, and then the patient who were chronic patients, especially for the heart failure patient, being treated in the hospital, and then the hospitals keep monitoring their situation and looking after the patient's conditions and providing the healthcare services time to time without intervening by the patient party, by the patient itself. So if you talk about the pandemic has taught two things, that clinical transformation has taken place drastically where the hospitals were struggling. Some hospitals were there who were ready to were spending the top technology and they're putting their best, but adoption was not going up to the mark. And some hospital were there thinking that the technology and spending on the budgeting for technology is not required, and they will run the show the way they are running. But finally, as far as the patient experiences has come in picture due to this pandemic, the adoption has reached to a certain acceptable level, and it has been demanded by the patient first, and then the doctor has also demanded that yes, this is the solution that they can engage their patients through the technology rather than in person. And a few of the hospital, I used to say that our hospital, we have changed our SOPs for the consultation, whereby we have said that the first consultation will happen in person, but rest of the consultation will be done remotely. Telemedicine, telehealth, which is the part of the clinical solution as mandatory option into the solution stack. So the demand from the patient, the acceptance, earlier the patient were not accepting, and they were believing that if they're going to talk to the patient, doctor to the patient in person, they were getting more satisfaction. And the doctors were not adopted because they were not getting the better response from the patient. So this pandemic has enforced the organization to adopt the technology, to adopt the clinical transformation, to adopt the digital transformation, and for that, the patient fatality, the patient has enforced to the providers, healthcare providers, and individual providers to adopt the technology for the better treatment. And on top of it, if the technology has come up, the patient's experience we're talking about, the most of the important that out of the pocket expenses for this, especially in the private sector, has been drastically reduced. So that's where the technology has played a vital role. But on top of it, it doesn't mean that the hospital has to go and buy a very costly technology. It definitely is not going to work unless the right people has been put in place and the process has been put in place, and then it has been mapped to the technology. Then it works in terms of the adoptions, a better adoption for the organization. I mean, if you're talking about the people process technology, means the people caters 35%, process caters 35%. So technology was not a issue earlier as well, and today as well. But today is more cost effective compared to earlier. But right people, right process is catered by 70%, and the technology just catered 30%. So the organization has also started understanding why they were getting failure, where the adoption was not happening. They have also worked back to back on the people and process, and then they started mapping to the whatever the technology available to give the better outcome to improve the patient experiences. That's what I would like to add from my side on this, what you have asked for.
Okay, I think you've really highlighted several of the changes that is actually happening and the whole change management that all of us had to be prepared for. I would request Mr. Sumit to take this conversation forward because you are providing healthcare across countries, across continents, and how is this seamlessly possible? What are your thoughts? What are your organization's perspective on this?
Sure. So I think very clearly, I mean, as Dr. Abdullah also mentioned, there is obviously a fair amount of engagement now with doctors, who are now keen to look at telehealth solutions. Patients also want contactless experience, so they also pretty much are embracing it. I mean, there was a joke which said, "Who brought in digital transformation in healthcare? Was it the CIO, was it the CEO, or it's COVID?" It actually is COVID. 97% people agree it's COVID. So in some sense, it's a big plus. I mean, all of us are realizing the value of technology, the value of contactless operations, and objectively, I must say that we have to be clear about what works well in which markets. So when we launched the telehealth solution in various countries, I mean, we launched in India, in Bangladesh, in Pakistan, Nigeria, Kenya. Not everything works in the same way. We thought it's a common platform. We could even have doctors from India consulting let's say, a patient in Kenya. But there is some elements that need to be considered, including the bandwidth, connectivity, etc. at Kenya, which I think we've seen. Some tweaks needed. So you have to. It has to be horses for courses. How do we ensure that we understand the context and deploy the telehealth solutions? We've done it pretty well. In the numbers, got very good traction from patients. I think to me, the understanding here with the pandemic, very much, we realize the value of understanding the immunity aspect, the primary health checkups, for patients. How do we try and engage with patients better? We start looking at prevention rather than just cure, because the bed capacity will not manage, will not be completely managed there. So there are several elements that technology can play a key role. And the engagement of the patients is the key, ensuring that we can connect with them, we can use data to measure, to manage, and deliver better value. I mean, we're all moving towards value-based care, outcome-based care. So to me, those are things that we have to look at carefully and ensure that whatever technologies we use, as was rightly mentioned, the people and process aspects are properly meshed together. We are actually helping and giving a much more integrated experience to the patient. I think over to you, Dr. Preethi.
I think you brought out several points, which is related to the fact that we are moving towards more, or rather the impetus towards telehealth, contactless, and also the fact that value-based or outcome-based care, and the more that the data or the evidence is being provided, it helps us know what's working, what's not working, what do we need to fix. So that's very, very true. And may I request Mr. Gunjan to, you've been really active, and you look at technology as very critical to all this. So what is your viewpoint?
So allow me to be critical. Am I audible to everyone?
Yeah, very much.
Okay. So allow me to be a little critical on this. I have a different or a parallel different perspective on this. I always believed that technology was never a challenge. We always had technology which was necessary. Technology was always a tool to make things happen. I believe it was all about mindset. Life has always been a very fragile, and it has been extremely fragile lately because of the pandemic. And in these extreme times, what happens is there's extreme turbulence. And when there's extreme turbulence, it is not the turbulence that hurts, but the usage of old and primitive methods, which actually hurts. I'm not trying to be a little philosophical here, but the fact that I have been working in hospitals, in many hospitals, and really, when you are really passionate about the things you have done, I like to say no offense meant to myself also and to anybody in the fraternity. But what we've been speaking about all these years is we take pride in what we have done in our hospitals. But the pandemic has taught us that this is not about a hospital. This is about cities. This is about nations. This is about the world over. So the panel discussions like these are fruitful in multiple ways. They are coupled of takeaways we take from these sessions. But the most important thing to discuss today and now and here on is that what we do for our hospitals, within our hospitals, and how much we can translate it further to the cities further and to the nation and to the world over. Please interrupt if I'm exceeding my timeline. And right. So what I'm trying to say is that probably in last 15 years and all these sessions which we have sat in, we had those certain technologies. We could do certain things, but we didn't do. We didn't do beyond our hospitals probably. And we can say that the system failed. We can say the government failed. You can put blames on a lot of things. You can point fingers at many, but what need to be done through these sessions and what need to be done through us is that the adoption of technology within a hospital is wonderful, but how much we are taking it further beyond the hospitals. See, the strength of our country is the diversity and the population and the disparity of information, disparity of technology adoption. I'll point out one more important thing is that I think countless people died in this pandemic, and maybe, and I hope not, but maybe this is one of a kind of a pandemic. But if it happens again, if it happens in other form and feature, what do we do now? Are we prepared today to do certain things? And besides the people who died during this pandemic, I think many people who survived, the family members who survived through and have seen their loved one, losing their loved one in the hospitals. Speaking about hospitals, there were two things which actually killed and people died within themselves. There were two things. The one thing was uncertainty. The second thing was opacity of information. And when we talk about technology, at least these are the two things, the least what we can work upon is reducing the amount of uncertainty. And there's another dimension to it, that it is not amongst the relatives and the patients who are suffering through the uncertainty factor and opacity of information. It was also with the healthcare workers in the hospitals, even the doctors. And it was not that it was somebody's fault. It was the collapse of the entire system, you can say. You can give it any adjective, you can call it by any name. But what the kind of belief we had in our systems, we were actually shown the mirror of it. So being a technologist, I deliberately am not speaking about technology. What I'm trying to speak about and convey through this session is that there has to be certain things which we need to do, which we think at the grassroots level. I'll just give you an example. Let's not start from 1st of July, 1st of August, or 1st of June itself. Some kind of system. We always contest this on this aspect that healthcare information has to be highly secretive. Somebody actually debated in one of the sessions that in US, when the top management people are hired, the biggest fight is to figure out and find out the files information about their health history. We don't live in that space. We don't live in the general person doesn't live in that space. So let's stop. Let's be little easy on the security part. Let's do it in a way that let's start from someday soon that we start giving healthcare wallets in an open source format. Let's these private hospitals develop something which can come out in an open source format, which smaller hospitals, and at least let's have one reference hospital who does something which passes on to other hospitals, which comes out free and is adopted by other hospitals across. Let's do it in starting from one city, across states, and across nation. I can speak a lot, but probably I have conveyed what I tried to. Thank you.
Thank you. I think you kind of really highlighted, because technology is definitely there and it's getting developed at an accelerated pace, but the bridge to the humanness and how we exactly, you spoke about the changing mindset, which is so important because I think Mr. Sumit also alluded to that when COVID probably accelerated that pace because telemedicine bill got passed literally overnight in the country. We've been having computerized medical record, a hospital management information system, but then moving to much more better systems. I think all of that, we could have done it earlier. We could have done virtual sessions like this earlier, but I think this kind of gave us the impetus. We will look at some of the points that you raised in a little while, but at this point, I would like to invite Mr. Naresh. You've always been concerned about the healing environment that hospitals must provide. So what are your thoughts on that?
So hospitals are basically for patient, and we talk about future of hospital, we talk about no hospitals. None of the panelists, none of the people who are listening to us ever want to go to the hospital given a choice. So that's the future of hospital. Let's accept that. But given the condition today, we have a building in a city which is called hospital, supposed to be healing patient, not making them infected more. We need to really get objective about what we have, because the awareness of what we have give us a choices, and then the innovation and transformation will come in, and the patient experience. So like I shared in the first introduction, my entire study around sound, acoustics, and building material. And that's what I share with you. Just to elaborate the point around sound and patient experience, I have a small clip to share, which is from a TED talk of a person whom I respect a lot called Julian Treasure. He's been a 5-time TED speaker, not TEDx speaker, 5-time TED speaker, which takes something to be 5-time TED speaker, right? This is a clip from his TED talk.
Hospital sound is getting worse all the time. Noise levels in hospitals have doubled in the last few years. And it affects not just the patients, but also the people working there. I think we would like for dispensing errors to be zero, wouldn't we? And yet, as noise levels go up, so do the errors in dispensing made by the staff in hospitals. Most of all, though, it affects the patient. And that could be you, it could be me. Sleep is absolutely crucial for recovery. It's when we regenerate, when we rebuild our cells. And with threatening noise like this going on, your body, even if you are able to sleep, your body is telling you, I'm under threat. This is dangerous. And the quality of sleep is degraded, and so is our recovery. There are just huge benefits to come from designing for the ears in our healthcare.
So the point which I'm making here is, as a professional who are working in healthcare, for a healthcare building, and building onto the previous speaker's point, is the people who deliver healthcare system. Okay, whom are we talking about to adopt a technology? A person who cannot barely focus his mind on his own breath in a hospital building? How are you going to learn new technology? How that nurse is not going to focus on being less anxious and not making an error, How we are going to work in a building where if you go as a healthy person, you will get more infection when you come out of that building than recovering and recouping yourself. The LOS is very important in India than anywhere else, not for the profitability of the building, but to make patients safe to get out of the building. So we got to touch upon various aspects before so AI, machine learning, technology, India being a hub in the world of computer backend software development, we will have access to it. We will have a sooner or later access to doctor being, like Yuval Noah Harari said in his Homo sapiens book, like glorified doorkeeper per se, because everything else will be done by machine. The data will be analyzed. We will arrive there. But what is the use of arriving there where 70% of 80% of our buildings where delivering healthcare doesn't have the basic amenities done well. We are pouring money into a lot of stuff, but without really paying attention to what really mattered for our system to have a great quality. We're talking about healthcare quality, patient experience. The future of hospital is really going basic, fundamental, deep, strong into the structure which we are getting into first. Second, the people who are running the facility, and I talk about sound, but there are air quality, infection spread through that, and how we are going some innovation around that, not to have a spread of bacteria, germs into healthcare. How do we really make it safe? Is the first stage, and then the innovation. Because if you produce a best doctor, he would dream about going outside India. So even if we make a talent available here, are we really going to attract them and make them work in our system? So ecosystem need to go to a next level, in my opinion, to really come up as a backbone of a global healthcare delivery system. Yes, we have that capabilities, we have that strength, we have that manpower and infrastructure and government will. Everything is in place, but we need to start looking at objectively where we are missing currently and build further on that.
Thank you. That's absolutely well said. And perhaps there are ways that is being measured as well. So I move on to Mr. Ajay. What are your thoughts from the packaging perspective? How do you see the future? How is that changing?
Yeah. Like the speakers, those who have spoken before me are like all from hospital background and totally different kind of a thought process, maybe technology. I'm taking audience to a little different topic. We were talking about this new normal. This is for the betterment of health quality, definitely, yes. I want to remind of Mr. Charles Darwin, who said survival of fittest. Now, this fittest need not be the strongest. It needs to be most flexible, and that's going to survive. Anything built to adopt and not built to last is going to be a new success story for this new normal. So if everything is getting adopted, people are adopting a change, adopting technology, how this will affect on packaging part. So this definitely packaging, for pharma packaging we are specifically talking about as related to healthcare, is definitely making a change. So now the new thing that has started coming up is basically packaging design thinking. It has to go along with the product design thinking. It is from day one. It's not that the product is made and then the packaging is made. No, it's like earlier it was mainly a kind of a potency maintenance of a drug product into the supply chain. We need to think about it. But then now people are thinking about patient-centric by design. So that's the kind of a new thinking that has come up. But why this smart packaging is required. There's a report of WHO in 2003. Now, after this new normal, there are lesser and fewer people who are actually believing in WHO. I'm not one of them, but then that's the story. But of course, this is from 2003. And this report is on medication compliance, which talks of adherence to the long-term therapy. This speaks of around 43% of the asthma patient adhere to the doctor's advice to take medication. When you talk of, say, depression, it is up to from 40 to 70%. And if it is like we're talking about hypertension, it is around 51%. This is what is the WHO report says. So overall, maybe it is 50% of the patients who are actually taking the medicine as per the advice of the doctor. So what do we do about it? And the study also mentions that if a reminder is given, this percentage will go up. You know where I'm coming to. Okay. So the smart or intelligent packaging is basically required for reminding the patient to take the medicine. One of my good friend, Mr. AVPS Chakravarti, he always mentions this as packaging is going to be a second physician. Now, how many doctors, how many physicians talks to a patient? How much information is being really shared about the product? Hardly any. But this is that packaging which actually speaks to the patient when he actually consumes it. So this is the kind of a last communication piece between a doctor and a patient. That's packaging. It gives you a total information about the product, how it is to be taken, blah, blah, whatever. You got the point where I'm coming to. So there are various materials which actually are giving a reminder about the next dose when it is to be taken. But these are all passive devices. It's like an alarm clock. You put the alarm clock to rest and again go to bed. It's something similar. So new packaging will speak to the patient. How it will? Like it gives an alarm on your mobile, and the mobile will not shut unless you actually open the pack and brings it near to the phone. So this is a kind of a new technology that is coming even in packaging point of view. There are pharmacy packages which are used in hospital where a required number of tablets or required doses, everything is put in one pack and then is labeled for a particular patient time that nurse has to give. There are insulin patches which are being worked out, which gives a kind of a day therapy of insulin. This is kind of this acts as a depot injection where for a day it releases the product. Now, doctors in this panel, or they might ask, like, I'm a packaging person, why am I talking about depot injection? The patches itself is a packing material. It's carrying the drug to a patient. Okay, so it's being considered as a packing material or packaging medium for that matter. So during this pandemic, it was also observed that there are a lot many diversions, lot many thefts, or the counterfeits. Everybody has experienced it, right? We have a technology that is already in use. Like Mr. Gunjan has mentioned, that technology is already available. It's a question of adoption. We have a 2D barcode printed on each pack for exports, but that's not happening in India. So can we adopt this 2D barcode printing or tracking mechanism within India, which we are already doing for exports? Last point which I want to mention is pharma companies are always like they want to connect to the patient. It's from pharma company background, but then this lot many health apps are 24/7. There are call centers. There's voice-enabled AI to help in chronic conditions. There is a digital therapeutics which with automated reporting to the companies. All these are kind of a marketing tools that company wants to adopt. But what company is getting out of it is basically enormous data. It's the history and geography of the patients. So this is basically going to a kind of a connected packaging. This connected packaging is being developed based on this particular aspect. We need to develop this through a patient interactive engagement. If I am telling a patient that you open and call me, whether it is authentic or not authentic, nobody will call to the company. But there has to be maybe as somebody was mentioning about the coupons or something which needs to be given to a patient, so the feedback comes back to the company. These are maybe few of the examples where companies are working on, and this maybe this is going to be a new normal in packaging point of view. Thank you so much.
Thank you. I think you brought out several points which are of critical importance in the sense that once a patient leaves the hospital, the entire follow-up and follow-up compliance to whether it's medications or other follow-up instructions that the hospital may have provided is totally in the hospital, in the patient's or their caregiver's hands. And I think technology, like you are mentioning, not only will enable not just the patient or the caregiver to ensure that, the follow-up is better or the compliance to instruction is better. But I think the important point that you mentioned is that data is going to come back probably to the hospital. So we are seeing, a kind of integration between different technology. I mean, we are seeing between all these apps which are related to health, those kind of things, and it's connected to your, you've taken the example of diabetic care. So, there are a lot of data which needs to come together. So I think if we just reflect another point that you talked about, the whole adaptability, and that's what our first speaker, Mr. Abdullah, also talked about, the whole change management. So adaptability, I think, is we're all somehow trying to be not only resilient in this time, but in our work within the healthcare organizations, how do we make the healthcare systems more resilient? And today is the International Nurses Day. So I think, just take a pause to kind of appreciate the work that's being done by nurses 24/7 all around the world, along with all the other healthcare workers, and just appreciate that. And just moving on, I think one of the points that I just want to take up in this round is Mr. Gunjan had talked about change of mindset and opacity of the information. And I kind of look at the other end as, well, if opacity is there, then what we are or should strive for is probably transparency of information, not just to the healthcare providers. I mean, we are saying, yes, let it be accessible to the larger group, not just to the leadership, but to the entire ecosystem who provides that healthcare. But I think more importantly, people are also looking in the community, people who are potential patients or caregivers or people in the community. They also want to access certain level of information. So I think there is a lot that is possible. So in this session, we've listened to some of the very key points, and moving ahead in this particular round, we are looking at how do we weave in this other stakeholders' perspective while designing the future. What is it that each of your organization, perhaps something you've already tried, and perhaps you are looking, or you're collecting certain evidence, looking at it in your meetings, in your decision making, and then making newer policies based on information that comes not just from the leadership or the providers, but from the greater community. So we're talking about in the future potentially a different type of dashboards, hospital or healthcare information dashboards, which would be available at different stakeholders. So in your perspective, what does that look like? And how do you weave in different people's perspective is what I would like to ask. Dr. Abdullah, would you like to go? Would you like to give your viewpoint first? Yeah. You're on mute.
Thanks for the very descriptive perspective which were put in the question. So before I answer the question, what you ask, I will come to back. But before that, if you are talking about the panel discussion is happening in the future hospitals and healthcare quality and the patient care. So they are a part of just left. I would like to add, we in Omni group, we are emphasizing to ensure to deliver the compassionate treatment. The compassionate treatment means the hospital has to be sympathetic, empathic during the treatment to the patient, and the empathy which is going to lead the compassionate. So if all this technology we have talked about, the facility we talk about, top class doctor we talk about, when we started talking about the services to delivering the services, the empathy and sympathy and being compassionate is very, very important to ensure that the organization has delivered the quality healthcare. For instance, I've given an example that in a hospital, I saw when I was there in the hospital in Jordan, King Faisal Hospital, there was a cancer hospital, and there was a baby who was suffering with that, and when the baby was taken inside the OT room, I was just standing in the nurse was the head nurse and the nursing, they were looking after the baby. They were just handing over. After that, the nurses and started crying, unlike the mother. And mother was very, very satisfied that, okay, the nurses are there and they are going to take care of my baby. And then I went and met to the baby's mother and asked, and that why do you choose this hospital, and why don't you, and you're coming from the certain country, and there's a better facility, why we have come down here. She said that the kind of treatment, the kind of compassionate treatment we get, I have never had that experience. So now we are also at Omni Hospital. The vision is to ensure that we are giving the compassionate treatment, which is again enabling the quality healthcare. And now the second part of the question which you had asked for, that how the dashboard is going to work. Of course, the dashboard is very, very important for that. I'll talk about more clinical dashboard rather than the non-clinical dashboard. Non-clinical dashboards, which may not be too scientific, but the clinical dashboards are very scientific. For example, if a diabetologist, he's treating his patient for 4 or 5 diabetologists are treating the patient, and one of the diabetologist who is treating most of the patient, and he's getting more response and due to XYZ reason. But whenever we have started taking the clinical data and started analyzing, that we found that for the past 6 months, the patient which are being treated by this doctor, the graph it is deteriorating rather than seeing the individual first. But as a whole, we start looking after that, why this doctor is looking after and what is the performance, and why the as a whole the treatment is in that case. Then we go drill down to the detail and which area, what area, from which area the maximum patients are deteriorating. There's not getting their health conditions are not improving. So that's very, very important. Then conduct a meeting with the clinical committee is going to meet the doctor, and then conduct a lot of the branding team is going to do a lot of campaign into that particular areas where the maximum deteriorations are happening for that particular area. And then and the hospital decides to take the measurable actions in terms of enabling the better care in the processes, in the treatment protocol, treatment clinical pathways, and that's everything is going to be reviewed, and if necessary, it is supposed to be put in place the changes to improve that particular dashboard, which has said as a whole that is the conditions of entire patient average is deteriorating rather than is improving. So that's very, very important, the role of the dashboard, the clinical dashboards we're talking about when the data is being captured during the treatment of the entire patient. So that's where we will look at, and that's where it's give the value. And again, when we are going to look at the details and try to do the re-engineering of the clinical pathways, clinical and the other processes, how it is being the diabetology patients, diabetic patients are being treated in OPD or in as an inpatient or an outpatient or a daycare. That data gives a lot of inputs to improve the gray area into to the hospital, and that's where that we improve the healthcare quality for the individual range. Over to you.
Thank you. Sumit, would you like to add your perspective to that?
Yeah, sure. I think the key thing here, I mean, I guess we talked about the availability and transparency of information. I think what we need to really understand is the patient journey, and also not just the patient journey, also the attendant's journey, because sometimes the patient is not in a condition to understand what's happening to him. So you need to also make sure that the attendant is well taken care of, because he's the one who's driving the care, in the within the hospital and helping out, the patient. So if you look at the overall ecosystem, there is insurance companies, there are obviously doctors, there are nurses, there is operations, multiple things, billing, uh, which are basically impacting a patient, and we need to understand how can we make the information available to the patient at the right time to make it much more transparent, much more easier to understand. Now, we also need to maybe understand the way we basically reduce bottlenecks. So sometimes the insurance company is delaying a payment, to a, let's say, customer, and the patient is not aware. He's blaming the hospital for it because the discharge is not happening. So that timely availability of information is also required to be able to, and reach out to them. And I think we are kind of at the stage when we need to start investing in the patient's wellness. So we talked about the fact that the patient is not just one transaction. Somebody who comes to the hospital, the compassionate care which Dr. Abdullah talked about. We have to kind of look at how do we ensure that this compassionate care extends beyond the walls of the hospital. You are able to connect using a patient engagement app, and you probably have a better understanding of what's happening. And we are even at our hospitals, we are exploring and in fact are also deploying things like net promoter scores to try and understand where could we improve further. What is the aspects that we need to improve patient experience on. So as you measure it, you're going to manage it, and that's where dashboards come in. I think when we talk about dashboards, very important that we start institutionalizing standards. We are doing it already. I mean, we've done it. I did it in Max. We did it here in Evercare. We're doing it. It basically depends on, can we have some standards for diagnostics, standards for procedures, ICD-10 maybe for diagnosis, maybe CPT or SNOMED for procedures, something which helps you make sense of the data, which helps doctors make sense of the data. What clinical pathways worked, what did not work? How should we improve the treatment? How should we improve the care going forward? Those are the things, when we talk about a single doctor versus a million doctors, what they've done, and kind of, compare that and then improve the quality of care. So we have to start focusing and embracing standards. The government needs to play a role. We as a hospital administration needs to play a role and then deliver that care. So to me, data is important, but the right data, the standardization of data, which would help us really improve the patient experience and the outcomes. Thank you.
Absolutely. Mr. Gunjan, would you add your comments to this?
Okay, so I generally have a different perspective to things. I think it is all about what this pandemic has. One thing which has taught us is to break that facade of pretension we had. The pretension, I'm speaking about the pretension we project on social media, the pretension of being very happy, very lucky. The pretension, what the systems project, the pretension which leaders project. I think there are two arts. There's one art of lying and one art of telling the truth. We are good at both of them. It's all about how we adapt. What is required today is that a lot of trust and confidence building is required. So if we excel in the art of telling lies, the steps are that you tell a lie and then you try to convince the other person, you push it across, and then you present certain data. That happens in life also. You sneak in your keys of your father's car and then you go out and come back and tell a couple of lies. That's the art of lying, which we have learned over the years, in some good sense also. But then there's the art of telling the truth. Truth is upfront, and then there are certain consequences to that. I believe the future of the world, the countries, the states, the leaders, and all the stakeholders in this healthcare fraternity would depend on the courage we take to tell the truth. And as I said, the level of transparency we come up with. And when we tell the truth, over a period of time, there would be a confidence building, there would be an image building, and then probably the consequences of telling the truth would diminish. We may win certain battles by telling lies, but we will win the war against anything, including pandemic, by telling the truth. So to begin with, we have to be persistent, and to move with it, have to be consistent. So this is the philosophy part of it. I'll give you a very good example. It was this pandemic that brought in something called an app, talking about technology, Arogya Setu. We know it had a lot of challenges. There was a lot of bugs, a lot of issues, and people condemned it. People were critical about it. It did not work out well also, but there was an attempt. But then we were not persistent with that. We were not consistent with that. So what I'm trying to say is that we do speak a lot about the success stories within our hospitals, within our corporate network, and we don't have anybody right now in this panel speaking from the government hospitals and government healthcare initiatives. But taking the liberty to speak from everybody's side, what we need to do is that there has to be bare basic systems wherein we start getting more transparent with the information. And yes, certain apps, like taking again name, not to be very prejudiced about that, but Arogya Setu takes information from you and give you the list. Any technology, any app, any solution will only work when it is engaging. And the biggest example is all your social media. So unless until you make an app, and this is for the leaders, because it has to come from the top. Private initiatives would be welcome, but then people again get prejudiced about that. So maybe support from the top, and then private players pitch in, and bare minimum basic app, starting with that we voluntarily submit and give a waiver to the disclaimer that, okay, we are okay with our information going out in public. My blood group, whether I had any COVID symptom earlier, whether I was diagnosed with COVID-19, basic information to begin with. And let's be a little liberal of that. Many people have handicap, many people have diabetes. I think let's be a little, simple and clear about this thing, that if we will not be upfront with sharing the information and get out of this fear of this information being used in some way, and then let's educate everyone. How much damage Facebook, Twitter, blah, 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 I'm not taking again names, has done to this world all over. Elections have been rigged. People's mindsets have been changed. I don't know what damage your sharing of your health basic information or your any health information would bring you to. And that is what my suggestion is, that let's begin from somewhere which is not limited to a group of hospitals or certain private group of hospitals. It should go at least to cities, it should go at least to states, it should go across the nation. The bare minimum, it will have faults, it will have issues, it will have bugs, there will be pilferage of data, but then we have to fix it. We have to be persistent and consistent with that. Thank you.
Okay. I think there'll always be a huge debate about data privacy and concerns about that. So I think in all the policies, we are seeing a lot of mention and a lot of importance given to it. So it's kind of consenting that fine line. Mr. Naresh, would you add your comments to, from a healing environment perspective again, how do you see, you showed us a video which really talked about the increasing sound and how it impacts on the patient. But going forward, you also talked about that the kind of healthcare models are changing. So let's say there are home-based healthcare, there's hospital-based healthcare, there's portable or mobile healthcare. How do you see sound playing itself in the design of all this?
Yeah, so I would like the perspective given by Gunjan about the facts to bring in, telling the truth versus telling a lie kind of stuff. And telling the truth starts with really looking at what's so. And the other point is how different stakeholders are getting impacted as we move ahead. There's a choice which we make, and there is drift with which we go ahead because technology is changing. And we got to be present to the both fact as a leader because this is our time. Okay, we cannot blame past and we cannot dream about future. We sitting in here, design in our own ways how the experience of human on the earth will be there in 2021. And many of the people sitting in government and many of the people running private hospitals are doing it in their own capabilities. So when we are really reflecting in a panel discussion like that, we should really check at what is so there and what is so is leading to what kind of stuff. So if I start with, like I said in the first talk, like with the previous panel discussion, we came up with innovation. We talk about putting one light which sense the sound level and turn red. The LED turn red. The entire behavioral aspects of nurses, the doctors, the waiting staff can actually change within a second because technology is intervening there. And it's just automatic. There is no human capability required. The light is changing. And many hospitals abroad we have seen having that implemented probably a decades back. We've been not really done that. I haven't seen many places it's been done. There are behavioral aspects. There are signs and stuff like that which can really talk about it. The colors can really play. A music can really impact the way patient experience the place. Waiting areas can really be a nice experience for people. Like Dr. Puri said, that the second person is the patient's caretaker. Can we really make it centric to a patient caretaker's point of view? Can the lobbies which are designed in our healthcare facility really be a cognitive of how emotions travel? If some accident patient is coming with the blood or arm broken into emergency ward, how that impact, or somebody died or somebody crying there, how it impacts the entire waiting lobby area for people who are just getting admitted into a hospital, maybe, how it impact the hospital image about all those things. Leave aside that, if you really enter into a hospital lobby currently, it's like an echo chamber. It's like a hotel lobby, 3-story, huge volume, hard surfaces everywhere, maybe marble in a good hot hospital, in a star hospital, or maybe government hospital is a large place which can accommodate people. But hardly any attention paid even to an announcement which is happening. If you go to Tata Cancer Hospital there, it's a huge lobby. When you enter into the hospital, you can barely hear anything. Like you've been exposed to 80 decibel, 75 decibel, like you feel you are in the marketplace. So what get improved is what Sumit also said. That's really is the next step toward we getting into future of the hospital here and now, which we should do into any facility we are getting into. Empathy we're talking about is a natural outcome of how you feel yourself inside your own skin. First, you need to be empathetic toward yourself, and then you could be about, otherwise it is faking. And faking can be really seen by people. So unless we put doctors and nurses and the caretaker in the center of our healthcare facility as the first recipient of all the good things we want to give it to our patients in the healthcare delivery system, the day will change that time. So I normally talk in my presentations to architects and designers about different areas in healthcare, right? And here we're talking about transparencies of information, but you also require a privacy of conversation, right? And there are so many times you've been sitting into a chair outside the consulting room, and you can hear what doctor is telling the patient, what patient is sharing the doctor. Now look, when you go back to that chair for consulting, are you going to share your intimate stuff? Maybe yes, maybe not, right? And especially if you know that what you're going to speak with the doctor is being heard outside. So if you are taking a rest in an ICU, like you saw in the video which I shared, if you can't sleep, or maybe in a private room, you're getting disturbed because of the movement of the trolley in the corridor, how good is that hospital for you? Or maybe something dropping on the above floor is heard in this room. How good is that, right? So each room, each zone, or each facility has to be paid minute of attention from the all direction, keeping the people who are using it at the center of that particular facility. And if you really say today, there are different volume of the room, But if you see a same material being used across the surfaces, which just says that we are not really designing that space. Maybe colors are used, but certainly sound is something which is missing when we're designing such facilities currently in India. So we need to be ensuring that there is a privacy enough for sound coming from one ward to another ward or one room to another room as an aspect of it. So there are multiple areas in which we can increase the excellence of the people. We can improve the quality of delivery system just by getting mindful about it. Just by playing a smooth music in the background, the privacy can go up in an existing facility and actually can enhance the healing of the patient. So these are the things which is coming to my mind right now in terms of way we can take up the current state of affair changing in a macro environment.
Okay, thank you. Mr. Ajay?
Yeah. So maybe for this question of better health quality and patient experience, I am really not a kind of a person who is expert in this area, but the patient experience, or maybe when we are talking about the hospital, we should say end users as nurses, and huge respect to all the nurses on this International Nurses Day. I would like to raise only few points. Most of the decision makers of the hospitals are here. So I'm just raising few points here. So if it works, let's see how it works. The first thing is, like, which comes to my mind is we're talking about packaging. So is it really patient-centric or patient-driven approach? Are we really adopting it? I think no. There's one survey which speaks of that from the company perspective, there are only 6% of the companies who think from patient-centric approach. All others are mainly responsive kind of a approach they have. We always had a quality by design. Now we need to have patient-centric by design. That needs to be built into our thought process now. The second point which I wanted to mention was a kind of a feedback mechanism. I'm from packaging side, so I'm maybe confining my statements only to relate it to this. So the nurses are actually the basic users of material in your hospitals. How many hospitals give feedback to the companies on the usage of the material? How much feedback is being taken from the nurses? Are you comfortable with this material? If it is no, I think we need to adopt this. All of you are consumers, right? You are using a lot many materials from FMCG point of view, like you go to supermarkets. What you think, you are a consumer, you are driving a change in FMCG market. What consumer is looking for there is basically convenience, expectation that this material should work every time perfectly, and the sustainability part of it. So even in pharma point of view, are we demanding this kind of a change? Who should ask for this change? I think this hospital needs to give this kind of a feedback to the companies. We were talking about vaccines day in, day out. The cold chain requirement for it. Are we giving a kind of a training to all the users on a regular basis how it is to be handled? For how much time this can be kept out of the refrigerator? These are all basics, but then maybe these points needs to be thought of going forward. Next to come was like cell therapy is coming up, the gene therapy is coming up, CAR-T people are talking about. All this, are we ready for all this equipment handling? There's now the personal medication, like product customization with individual patient labeling will be a fundamental requirement of personalized medication, which is coming up very shortly. So are we really ready for all this? I would like to mention Gunjan's point here, which he mentioned in the first answer, that the uncertainty and opacity of information. So related to that, maybe the last point which I want to raise is, in case of such pandemics, or if anything comes up in future, what should be the thought process? So reducing the probability of it and increasing the speed of response are going to be critical for the sustainability, this flexibility. So building of a strong defense with risk awareness culture might help in future. These are maybe the thoughts that I have in mind, as I am not from a healthcare background, but then maybe these thoughts might help. Thank you so much.
Thank you so much. So I think one of the things we've realized is healthcare is made up of so many people. There are people in healthcare, of course, and there are people from outside healthcare, and everybody together can only make good healthcare happen. There's no doubt about that. Each one is playing its part, and we're almost at the last end of our panel discussion. I would just quickly ask each of our panelists to kind of give like a closing thought in 10 seconds, 10, 15 seconds. So just a word of advice on what are we to expect in the future. We've kind of looked at several things that are happening and we need to be aware about. But, so if you have any closing comments, I'd just like to make a brief statement, perhaps. Mr. Abdullah, could you kindly unmute?
Quickly, we are the CIO group. We have different groups, CIO club and Champ club. We are talking to the the product companies who are developing the solution for the healthcare. So we have given three goals to them. One, as per we are talking about the transparency and the information transparency. As per the compliances we're talking NABH and HIPAA and JCI, all these keeping in mind, we have given that inputs that the solution means if you're talking about the digital transformation means the solution supposed to be digitized and it will be available on platform independent, whether it is a phone, any kind of phone, whether any gadgets are supposed to work independently. Second, the solution should be faster than paper. The response of the solution should be faster than paper. If a doctor is scribbling a prescription 3 minutes, that at least the system should allow to complete the prescription in 3 minutes. It does not need any training. Means it's supposed to be designed in such a way that doctor does not need any training. He's supposed to just log in and start working because he knows much better the clinical jargons, clinical dictionaries than anybody else. So faster than paper, it does not need any training, and second response. These three things has been given, and on top of it, the telehealth, telemedicine, it should not be a add-on solution. It should be a part of the main solution stack. It should be a mandatory module of the main solution stack of clinical applications. So now a lot of the clinical applications which were developed were what we say the telemedicines was not there, so they have added into the main solution stack as a mandatory options. So most of the health product companies started developing it, and they have started deploying it, and on top of it, we have said they are not going to charge to the hospital even. So that's where the lot of hospital have Mobile Work is one of them. We has deployed the solution as the Medanta group. So they have done that as well, and hopefully they have deployed in the Cairo group of hospital, and they have added that features on the fly and implemented end to end. So that's the conclusion from my side for the healthcare industry.
Thank you very much. Mr. Sumit?
Yeah, so I think I just would say that healthcare is a very complex and much more, I would say, difficult, kind of sector. Given all the complications, every person is different, and we all know the challenges. That the Indian healthcare system, the private hospitals and government hospitals are facing today with the volumes. My own parting comment here is collaboration is the key. Collaboration between different players in the ecosystem. Making sure that we can basically work well together. Increase transparency, increase customer centricity, and the need for standards. And we can measure to manage. If we measure well, we will manage well. So that's the only point I'll just like to say. I think we have to start looking at a different way of working together and collaborating to improve patient service and outcomes.
Absolutely. Thank you. Mr. Gunjan?
Yeah, I would like to put across two things. In these challenging times, rightly said, collaboration is the key. I'll just elaborate this bit. If we have observed, there are individuals, people, communities, people who are coming forward to help people, others who are in need, using their own funds, using their own resources. Probably, if I hope the panel discussion which we are having right now is being watched by others, and subsequently, if you put across on YouTube or some channel, people would see it. It's just a suggestion from my side that I think this is a good opportunity for corporates to identify the genuine ones who are extending these services to the community, and maybe they can build up a non-profit or a least profit model across around them, so that these are sustainable in future, and probably these are the people who would further collaborate with the other healthcare service providers and these hospitals, government or private, because the challenge has been that it was unfathomable amount of pressure which came on healthcare system. And I've seen, I would like to mention that there are certain religious streams, temples, gurudwaras, which are doing this. Besides that, there are individuals who are pitching in with their own funds, and then they are bringing people together. I think these are the people who have to be supported by systems, by other individuals which have some kind of other resources. Probably they can support money or other things, and then companies like players like which are into packaging, they can do co-branding. I think I'm not here to give any kind of business solution over here, but probably they have to be encouraged so that they survive through this pandemic and they remain in prevalence, so that in future, if any crisis comes, these people are there ready to be looked up to and prepped up for the future. The second thing is that's a appeal through this panel discussion, is that we should communicate and convey one message, that we should be very gentle and kind and respectful to the healthcare workers, nursing staff, and doctors. It's not that people who lose their loved ones and their emotions run high, and then of course the hospitals and the doctors, nursing staff, everybody, they themselves are under tremendous pressure. We don't want to get into this discussion who's making money, who's not, but they are there saving lives. The people who are there at the front line exposing themselves to this virus, I don't think they need to prove themselves any further. So let's express a solidarity with them. Let's be kind and gentle with them. Let's do certain things to make them comfortable. Try to extend our support to them. Be respectful, the least what we can do to them, and protect them if somebody tries to hurt them. Thank you.
Thank you. Thank you very much. Mr. Naresh?
Yeah, so taking forward what been said up till now, quickly, we need to really, to get to a next level, we got to measure, to improve, got to measure what is we are delivering, So measuring simple apps on the mobile phone of a doctor. So there is action request from my side. All the people who will be watching this and panelists out here, you can have a sound meter or a RT meter on your mobile phone, and you can see what kind of a noise level we are exposing ourselves and our patient. So WHO says 35 dB. Oh, do I have a 65 dB in my hospital? Or am I doing consulting in 55 dB noise, background noise? Am I getting disturbed when I'm talking all the time? So something around that can really improve the quality of the life of the people who are delivering it. We talked about today is an important day for nursing day, but yes, they are the one we are indebted to for whatever has happened in our life up till now. So we will work as a community toward getting more empathetic, getting more customer centric, getting more patient centric as we come out alive out of this pandemic. And I'm pretty sure this big challenge, which as a country we have faced, has power to transform entire quality of delivery systems and infrastructure for India and for the world. Yeah, thanks.
Thank you. Mr. Ajay?
Yeah, there are no special comments as such, but then it was a great learning from all of you for regarding the healthcare part, and just pray that nobody has to face such kind of a pandemic again in our lifetime. Thank you so much.
Thank you, everybody. And that kind of concludes this panel discussion. And at the end, I just would like to add a couple of comments, which is basically we are looking at the future. We are definitely looking at whether it's related to patient experience or quality. There are some definite steps that have been suggested by the panelists. For example, whether it is sharing of clinical pathways with each other, so you know what works, what doesn't work, institutionalization of standards. We've looked at what kind of data needs to better come in. So there's a clinical part, but then this audience, this panelists have also shared about certain other measures. For example, how do we really measure empathy? Whether the patients really got empathy to the level that they wanted in our dashboard. How do we share and make sure this data is available across the different stakeholders? And finally, we remember that this is the patient's journey. So at every point of contact, the moment of truth is there as to actually what has happened. And at the end, let us all be kind, definitely, to everybody, to each other. I think the world needs more of that at this point. And thank you very much, and be safe. Thank you.
Thank you, Thank you, Professor Preethi. It was a really well moderated panel from your end, and the kind of discussion, the brainstorming which happened around future of hospitals was really great. So it's like this half day we started at around 10:45 today, and it's like we had three panels, and all those three panels are some really interesting discussions, interesting outcomes which has come out from this panel discussions. So like in the morning, we had a panel on leveraging technologies for the public sector. Then we had another panel which talked about reimagining healthcare through innovations, and now the future of hospitals. So I think so. What the and Naresh was, I think so. He was part of all those panels there. So we had some very good discussions, and I'd really like to thank you all for being a part of this conclave. And we would like to have you in our future conclaves also. And for just to answer to one of the Mr. Gunjan Kumar, he said that if this can be on YouTube or this thing. So this event conclave is already live on YouTube. So we'll be sharing that link also with you. Also, you can have a look at that. So with this, I would like to thank you, and I would like to close this event here. Thank you all. It was a pleasure. It was an honor hosting you here. Thanks a lot.
Thanks so much.